This is the portal the practice will see when they get their information. This portal that you're in here now is the Connect App portal. It has all the key features of what we're looking for. You've got the message queue of the messages that come in to the practice. You can see those immediately. You can see which ones need to be escalated, which ones need to be looked at every day when they get that message. We can see the patients and what the patients are looking at every day. See what their reports are for them. They've got some neat reporting features in there we can look at on the reporting side. We can show the billing side, so where you have the ability to manage that process. We're not automatically assuming that everything is billable. We've got some codes and some logic built in here to make sure we're doing that correctly, compliantly, and everything else that goes with that, okay? And then we've got a reference library here for all the CPT codes and ICD-9 codes. So if you do have a question about what that code requires for what it would take to monetize it or how to manage those codes in your billing system, there's a nice little portal here for that, okay? So we've got a lot of pieces in here that help us manage that process. All right, so we're going to load here into the message queue and look at what's going on. You've got some test data in here. Now, everything in here, some of this stuff we've tested, some of this stuff is in here that the patients send in. You'll see the patient side of this and all the things that they could be sending in. So, for example, I've got a blood pressure reading here. I see that the person sending that message every day, is that a safe message in our system, or is that an escalated or a SOS message, okay? And you'll see the system refresh every few seconds. It's built to make sure that we're catching messages as they come in. There's no lag here in when that's coming in. So you've got a lot of people here that send blood pressure. This is a cardiology practice set of test data in here. You'll see a lot of things in here around blood pressure and monitoring that. You'll see how many steps someone logged today. You might see their daily check-in for how they're feeling today, what's their weight, all those kind of things. So as you see this build up in data, you start seeing the ability for us to manage that data in the practice so that we can see what's going on. You also see here on top, from a practice portal standpoint, you might see that I have 5 messages that require my attention. These are some test ones we sent in. Say Perry here got a message he sent in. If I want to escalate that message, even if it came in as what we call a safe message in our app, we can escalate that and say, hey, the patient may not have thought that was an SOS message. The doctor saw that reading and said, hey, I want to escalate that, or the nurse saw it when they looked at this portal. I need to escalate that, mark that, come back and look at it later, or make sure that that message gets sent directly to the text message we have on file, the text system we have on file for that office. If we want to have a text phone that each office has as their main number that they want the SOS alerts to go to, we can set that up in the system as well, okay? All right, let's go back here and look at a couple of things that we've seen that to show how we did this from a practice management standpoint. This is the main dashboard with all that populated in the messages, okay? Each practice has their own environment. The environment includes a text number assigned to them that goes from our app and Active SOS to their phone, to their dashboard here. All the messages come into their message queue based on it being sent to this number here, this 1-405-500-7270. That is the number assigned to that practice through our Connect portal. It says all our messages that go to that text message will go to this portal, okay? That's a key to this because it allows us to control a lot of that stuff that we wouldn't be able to control without that. Let me show you something real quick. While we're doing this live, I'm going to pull up my phone. You're going to see this live in our system. All right, you're going to see this live on my phone. This is my screen here. I'll put it right over here live. You saw me do all that. This is the SOS app. It has location tracking in it like a Life 360 app does. They're much more accurate than they are. We have a lot of features in here that support both business and consumer side of this for families and to stay safe and stay connected. We've also built this into it as well. In this process, this is how the app works for the patient. They go in here and they send an alert. They decide, is that an SOS alert or is that a safe alert? Okay. That safe alert or SOS alert could be any number of things. They can put in here any message they want to put preloaded into their system. They can put in here. Won't go through all that today, but that's how this works. Let's say I'm a medical patient and I want to let the doctor know I've got a medical alert, pain level 9. I've got different practices in here you can see I've tested with. I'm going to send this to the cardiology practice, which you're looking at here, cardiology OKC. I'm going to send that message. That message has been sent. Okay. Now, when I go back over here to my portal, get rid of that screen, I will see in my message queue, I just sent this. It's refreshing here. David Zink sent this message, medical alert, pain level 9. Okay. I just sent that. This shows in my exact location. That patient does need help. You need to reach out to them. Whatever that message location comes in with the message, so if there is a medical issue, we know where they are. Okay. And in this process, you'll see an exact Google map of where this is. Okay. All right. You will see me in Oklahoma City. There's my house. That's where I'm at. Okay. If I drill into this, you're going to see a very exact match. This is a little sales pitch from us. As you'll see, that's me standing in this bedroom right now in my house. Okay. So very accurate, down to a 17-digit GPS. You will know where that person is. If they do need medical help or do need attention, we need to reach out to them. We know exactly where they're at. Okay. That's a feature I haven't seen anything else that any of the RPM or RTM spaces have. Okay. So that's a pretty good summary for that part as far as the dashboard goes. Let's look at the patients real quick. I go in here and see where the patients are. Here's all the patients. Here's all the features I've got to look at those patients. I've got 52 patients loaded in here for test data. I can see their information. I can see their phone number. If I do have to reach out to them, I can see what their billing process is. Is this an RPM or an RTM type patient, depending on the kind of codes they're using or what their care structure is. I can edit that patient's information, okay, and I can see the codes that that person has been assigned, what kind of things they're looking at. This one has heart failure or primary hypertension. So we know what codes are in the system to see if they're billable for those things, to make sure we're not putting RPM or RTM solutions in that don't match an ICD-9 code, make sure those do match. And I can see what alerts that person has sent in. If I go in here and look at the message queue in total, in this view, I can see all the information that person has sent in over time. Okay. All in one view, all in one portal, all in one place. Okay. I can also go back in here and put a log interaction in here. What this is for is if I need to log a manual activity, I can go in here and say, okay, I talked to that patient for 5 minutes, 10 minutes, 1 minute, see what I had. Was that a call? Did I just review their messages? Did I talk about their care coordination? Did I try to escalate what was going on? This gives us a way to document the activity, because it's not just the alerts you have to document. You actually have to document from any of these codes how much time have you spent with that patient during the month, looking at their data, monitoring their data, either individually or in total, to see that we're monitoring that patient and giving them care. Okay. That's part of it too. We're looking at this to be compliant. We're doing this to help you document what you're doing, take all that overhead off for any kind of manual documentation for that you might have to do to support that. We can go right in here to their record right in here, put down 5 minutes. I can add 5 minutes to their information. I can put little comments in here if I need to, and for the activity notes, and I can manage their information right there. I called that person about prescriptions. That was a 5-minute phone call. Now I've added 5 minutes to their record. So I spent 5 of the 20 minutes I need to spend on this patient this month to document and be eligible for that patient to bill their codes. Okay. Let's go over here to billing real quick. Look at the billing side of this. This is where it gets kind of interesting. I've got data in here through May. I can just look at that bill for May for my process and see that on 52 patients, so far I've got $5,700 eligible to bill that month. We've documented and completed 1,868 of them through the review process. Now, this is pretty raw data. This is just done for testing purposes. Most of this will be automated where you won't have to touch this, but we set it up to where to show you how it would work. Okay. If I go in here and I looked at one earlier, I wanted to go back and look at Deborah Harris. I can look at Deborah Harris. I can see that for the month of May, she sent in 18 messages. Okay. We spent 23 minutes with her in different interactions. We have met the interaction criteria. We can see that she may be a Medicare patient or she could be private pay. This one says she's a Medicare or commercial, other options. And we can see that she's met all the criteria for this. And if the system doesn't automatically do it, which we can set it up to do automatic if it meets the criteria, or we can set it up to where you want to manually go and review these, this is one way we would manually review it. Right now, it shows me that she is $107 eligible for the month, but we haven't approved those yet, so it hasn't shown any ready to bill yet. Okay. If I go over here to that first one and say that one's ready, I'm going to mark that ready. Okay. Now I've shown that I've got $52 ready to bill from her. Our ready to bill for the month went up, and I can see what else is eligible in her process. Okay. Now, if this patient does have a device that she's using to monitor anything that relates to her care that you're helping her monitor or manage, then for that she would also be eligible for 99454. If we don't have an extra device that she's using that is truly an FDA approved device, and I'm not going to sit here and say we're FDA approved because we're not. We're just tracking data and tracking interactions. But if she did have that device, pacemaker machine, some kind of blood pressure machine that we're using to monitor her blood pressure, we could also mark that. And mark that ready. That would give us another $55 at Medicare rates. We could bill up to the $107.23. Okay. So there are other codes in here. We can customize this for your practice with the kind of codes that you use. These are the base codes that fit for most cardiologists. There's other things we can add to this. We are trying to keep this very conservative in how we approach this. We're not trying to throw out wild and unverifiable numbers. We're trying to keep this conservative because we do think there's more here that meets the eye, and there's enough here to make this worthwhile. Okay. Last thing I'll show you as we go through this on the report side, but right before I get to that, let me just show you we did build a CPT code, an ICD-9 code database in here. And in this process, take something in the background here I've got to work on, but this just shows for every code that we have built in here, we want to show you that we are doing everything we can to keep you compliant, to show you which codes fit, which ones don't fit, what those codes might be from a billing standpoint, from all the different numbers, okay, for all codes, for the RTM codes, for the RPM codes, continuous care, therapeutic care, all the things that are going through this, we've got to make sure we are covering to make sure we are showing you, everybody that's asking about this knows that we're doing everything we can to be compliant. We want to keep you compliant. We want to keep you on board with what we're doing, whether you're an OBGYN practice, family medicine, cardiology, whatever that might be. We can show where those codes apply to those specialties and what those look like. All right, last part here I'm kind of proud of. We've got some reports in the process we can go through. But if I go through here and look at different monthly reports, if I go back to May, because that's where I've got the last data built in there, okay? And I go back and look at, let's say, Stephen Adams. So go back and look at these reports. Oh, all right, patient activity reports, okay? And I go through and look at what each patient did. I can see this in summary. I can see if they met the criteria for those reports. I can see how many messages and transactions they sent in, how much time we spent. Did we meet the 20-minute threshold for the first code? Do we have other codes that we can also apply to? Do we have any SOS codes? We've got a basic understanding there, okay? We've got out of the 52 patients, 2 did not meet the threshold for billing, but 50 did at some level, okay? All right. We can see the alert history. We can do exports to your EMR and EHR systems. We can look at alert transaction logs. A lot of ways we can look at data here. But the one I kind of like is this AI patient analysis, okay? If I go back and look at, let's say, first one on the list, Stephen Adams, okay? For 3 months, he sent in 22 alerts. We got asked by the doctors to say, I don't want to get a report that just shows this person had like 50 alerts next time they come in. I don't want to sit here and read all these alerts and see if any of them are good or bad or otherwise what's going on. So we built inside of this a couple of different options. One, they can just export this to Excel. If that's the way you like to look at data, we can print the report. The one thing we can do is do a little AI analysis on it. We built a little embedded Claude analysis. Behind this, it says, give me his information for the last 3 months. You had 22 alerts in the period, and it takes all that information and says what he's done. He had 22 alerts over about a 5-week period, excellent compliance and medication adherence. He had activity tolerance and vital sign stability. Current vital signs are this on average, and cardiac assessments remain reassuring with no active symptoms. Okay. Historically, had elevated BP readings from mid-April and resolved to normal range by May. Okay. This is a 3-month running average. It's showing you month-to-month comparison. Okay. What alerts need to still be looked at? What's his historical patterns? What are his weight readings? So in that summary, the doctor didn't have to look at all these details down here. They can just look at what that summary is up on top. And if they need to go down to the detail of any other ones to compare him to, they can go down here to the common patients that might be comparable to him or her and say, okay, how does that patient compare to another one? Okay. So a lot of data here that you wouldn't normally get by just having the patient say, I'm going to write down all my blood pressures for a couple of weeks and bring them back to you. It's a little bit more in depth than that, a little bit more encouraging that we can do that. And it gives us a lot more data and a lot more interaction than we would have had otherwise. Okay. So nice little overview. That's about 20 minutes of me jibber jabbering. We'll cut this up and do this in different ways to see what works the best for a demonstration. But I hope that helps. You'll have my contact information, the information that sent this to you. And feel free to reach out, book a more detailed review of how this might fit into your practice and how we might be able to help you do this. But we want to improve patient care, improve patient outcomes, and if we can, monetize it. Pretty simple process and pretty simple goal, but one I think that we have a unique solution for, and I hope we can fit this into your practice and fit this into your patient care model. Thank you very much.